So I want to talk to you a little bit about dialectical behavior therapy, or DBT, and discuss the 4 important components that make this such an effective therapy for people struggling with borderline personality disorder, which is one of the most painful and difficult conditions that anybody can be facing. I'm Dr. Sonia, and I'm a licensed clinical psychologist who has worked with a number of individuals over the years struggling with borderline personality disorder. I was trained in dialectical behavior therapy, which is the evidence-based treatment for borderline personality disorder, and that has had significant success in relieving distress in a number of people who in the past were seen as untreatable and unworkable. And since this therapy has come out, it has brought hope and help to people who otherwise would have had to struggle with this on their own. So there are 4 main components of dialectical behavior therapy, or DBT, and these include an understanding of mindfulness, learning skills for emotional regulation, learning skills of distress tolerance, and learning skills around interpersonal effectiveness. And through learning these skills and working with a DBT therapist, people with borderline personality disorder find significant relief and a sense of structure and stability over something that previously felt really uncontrollable. So the first component of DBT that I mentioned is mindfulness, and this is the idea that we need to be really present, non-judgmental, and aware about our current circumstances. And this is a very, very important skill for people, for anybody really, but specifically people who struggle with kind of an unstable sense of self and a difficulty with staying kind of grounded and focused in the present moment. The second skill that DBT teaches to people who have borderline personality disorder is emotion regulation. And there's a couple different aspects of this, but essentially it's the idea of learning to be comfortable with and accepting of your emotions, and then learning how to manage difficult emotions so that they don't end up controlling you, but that you have the ability to choose how you react in any given situation, despite what you might be feeling in the moment. Distress tolerance is also a very important skill that's taught to people who are in DBT. Distress tolerance is really this idea of when your situation seems unbearable and intolerable, what are some things that you can do, healthy things that you can do to manage your behavior and your emotions so that you don't do something impulsive or risky that ends up having negative consequences for you down the road. The final component of DBT, which is really helpful for really anyone, is interpersonal effectiveness. And this is just the idea that through learning how to communicate in healthy, respectful ways with others, to assert ourselves and to have really good boundaries, we can then have more stable relationships with others and build trust. And this is so, so important for people who struggle with borderline personality disorder, because trust is one of the things that they have the hardest time with. So interpersonal effectiveness really gives them the skills to start to have better relationships with others. So if you or someone you know either has been diagnosed with borderline personality disorder, or you suspect that someone you know might have borderline personality disorder, I strongly encourage you to get in touch with a qualified DBT therapist, because it's one of the most effective and evidence-based ways of dealing with this diagnosis and really helping you lead a happier, healthier